Welcome. Welcome back to the Partnerships COVID-19 Business Forum series. Today is our member address. We're going to give it just a moment for everyone to log in. I'll keep a information screen up for you if you'd like to take a snapshot while we're waiting for the program to start. Screenshot or this deck will also be available to everyone recorded after the session is over, so you can grab the information at that time as well. We'll get started in just a moment. This morning's session will be focusing on Governor Abbott's recent open Texas order. Partnership President and CEO Bob Harvey, and along with our Senior Vice President of Public Policy, Taylor Landin, will be walking us through the plan and the executive order and what it means for Houston business. So again, thank you for tuning in. If you're not new to our web sessions, you'll know that we do provide these virtual meetings once or twice a week. And member address is just one component. We also have our COVID-19 workshops as well as other networking events throughout the week. And one question we always get is whether or not we are recording. And indeed we are, so you are able to receive this information. It should be up a little bit later this morning, probably around noon today. You can get all of our recorded sessions on houston.org coronavirus. So if you go to our website, houston.org, that'll be the first thing that you see as well. Also, we have a lot of information we want you to be aware of. The partnership posts new information regularly. We understand how important timely information is to our members, and so we're posting regularly on houston.org. We're also sharing information through our partnership daily briefings, and these are emails that you'll receive in your inbox every morning. We're also hosting these webinars, and we're also working with our business and community leaders and sharing that information on a regular basis. So please take note, when you do go to houston.org, you'll have access to our Houston Work Safe company information. We are going to be updating that with new recommendations for employers on reopen. And also our Greater Houston Business Recovery Center. You have access to information, and that's great information for our SME community. Also, I want to make you aware that on Mondays through Tuesday, the survey is open. We have our Houston Business Barometer survey. If you we do send an email out so that you have access to it every Monday. And again, through Tuesday, it closes at Tuesday at 5. And this is just great information for us to be receiving from our members to learn about where you are during this period of time. And then we do release those results on our website, so you can actually access the results as well. And if you want to engage with the Greater Houston Partnership, we are back to some regular programming, albeit virtual. Our business resource groups are meeting now virtually. And here's a list of those 9 groups. And again, this information will be available after the event is over, so you can grab the information as well. And we also are meeting regularly with our councils. These are our lunch and learns, and we'll be doing those on every Tuesday. One other thing, please mark your calendar for May 27th. May 27th, thanks to our presenting sponsor, Mitsubishi Corporation Americas, we will be broadcasting our first State of Address on Houston's global economy. And Patrick Jankowski will be delivering his Global Houston report, and he will be preceded by a fireside chat with the chair of the Albright Stonebridge Group and former U.S. Secretary of Commerce, Carlos Gutierrez. There is registration required, and this is a streamed broadcast event, so not a webinar. So before we go ahead and get started with our program, I'd just like you to take a moment to take our poll. And we are very interested in hearing what you have to say about our programming. Appreciate very, very much you answering this question, and this will help us to kind of gauge what we're doing in the future. I'll just give everyone just a couple of seconds to share. We're about 300 people on the call today, so just take just another minute or two. I should say a few seconds, probably not a few minutes. While we're taking the poll right now, please notice the chat bar on the side. Please use the chat for any technical issues that you might be having or to communicate with the staff that's behind the scenes. And also use the Q&A tab if you want to submit any questions to Bob or Taylor today. We're going to use the Q&A tab to actually answer your questions for the speakers. There's also a raise your hand feature. You can use that again if you're trying to alert or get in touch with somebody from our staff. All right, well, I'm going to go ahead and end the poll. Thank you so much for answering, and it looks like our webinar programming is useful to you all. So great to hear that. All right, well, we're going to go ahead and get started with our discussion. Please welcome Bob Harvey, the Greater Houston Partnerships President and CEO, and Taylor Landin, our Senior Vice President for Public Policy at the Greater Houston Partnership. They will be conducting a moderated session. Bob, Taylor, welcome.
Good morning, everybody, and good morning, Bob. Good to be with you again this morning. As Carrie mentioned, I'm Taylor Landin. I'm Senior Vice President of Public Policy here at the Greater Houston Partnership. You'll remember that we did something similar to this a couple of weeks ago, and I see that we have another great audience who've joined us again this morning. And I know Bob shares this sentiment, but it's a real honor to continue working with and on behalf of our members during this time. So it's been quite a week. There's a lot to cover, and we've been. I think the biggest news of the week was the release of the Reopen Texas plan by Governor Abbott and his accompanying executive order. And the partnership's been working on reopen plans for Houston for several weeks now, not knowing precisely what would be in the governor's order. And we'll talk about all of that in a minute. But first, I think it's important that we set the stage. So we're really fortunate, it goes without saying, to have the Texas Medical Center here in Houston during this time with access to some of the world's leading medical professionals. And what we've been hearing from our healthcare community, and it has been driving much of our efforts. And Bob, I wanted to start there and have, what are we hearing from our medical community? And then more specific to business, do you think, or does the partnership think, that Houston is in fact ready to reopen?
All right. Well, thank you. Thank you, Taylor. Sorry about that. Excuse me. And thanks, Carrie, for kicking us off this morning. And thanks for all of you for joining us on this webinar. Excuse me. It's been quite a while since we began teleworking at the partnership. It'll be 7 weeks tomorrow. So we've all adjusted to the new normal. But it's exciting to begin thinking about what the reopening process might look like. So Taylor, before I answer your question, I do want to express my personal thanks to Bill McKeon, the president of the Texas Medical Center, and all the leaders at the Texas Medical Center for their leadership throughout this COVID-19 crisis. We're so fortunate to have those institutions in our community and to have them working so well together. You all may have already heard this, the CEOs of the TMC institutions get together on a call every morning, 7 days a week at 7 a.m. To share the previous evening's data and to talk about the implications for Houston and what this means for our community. And beginning several weeks ago, Mark Watts, who leads the partnership's efforts around COVID-19, he and I get on that call at 8 a.m. They basically continue for another hour twice a week. And we participate in that discussion, and that's been extremely valuable. And I would say without the help of the Texas Medical Center, we would truly be flying blind at this point on this crisis. So to your question, Taylor, the good news is when I look at the data, we're at the point where we're ready to begin the slow, deliberate process of reopening. When we instituted the stay-at-home order, some weeks ago now, March 24th, when the county judge issued that order, it was with the understanding that we would be flattening the curve, and then once we had flattened the curve and went a couple of weeks beyond that, we could begin talking about reopening, and we're at that point. So rather than show you all the charts that the TMC leadership shares with us every day, I wanted to just focus on this simple summary. And as you see on the top left of the chart, the number of daily new cases in the greater Houston region peaked on or about April 10th, 18 days ago, more than that now, 20 days ago. And it was quite volatile at that time. The test results were coming back in a lumpy fashion. So you have to smooth that peak out. But let's say that peak on a smooth basis was between 500 and 600 new cases a day in greater Houston. So these were confirmed new cases. We're now down in around 200. You see that we dropped below 200 yesterday. Hopefully we'll sustain that. I noticed in the Chronicle this morning that it seemed to have jumped back up above 200, but we've come down a lot when it comes to new cases. And then the other three statistics you may not see as often, they come directly from the Texas Medical Center. And it's the summation of the reporting of all the TMC institutions, not just within the medical center, however. It looks out across their 9-county setup. And you can see on those charts that we've come down again from the peaks. And if you look across those, you might average those at, something 20 to 30% now down below the peaks and trending in an attractive direction. So the bottom line of all that is we would say that we have met that initial requirement for reopening, at least as it relates to the indications of the progression of the virus through the community. Now, not shown on these charts, but in data that we also see every day, is the capacity of the medical center relative to this loading. And those charts indicate that we have sufficient capacity, both base capacity and surge capacity, to meet these levels, even the previous peaks. Plus, if we were to have an upsurge of some sort, we're prepared for that. So the two key criteria really are to get beyond the peak and data like what you're seeing on the screen, sustain that for at least 2 weeks, and then to be well below the capacity limits of the healthcare system. All of those conditions have now been met, Taylor.
Well, that paints obviously a very, very good picture in terms of where we stand with all of this. And so I think that has given us at the partnership the assurances that we need to move ahead in a methodical way and think about reopening the Houston economy. And the governor's report to open Texas that was released on Monday is certainly a huge step in that direction. I think our members would appreciate knowing how engaged we are at the state level. Obviously, as you would expect, the partnership's been in ongoing contact with the governor's office since the crisis began. And in addition, we're thrilled to have 3 partnership board members that were tapped by the governor to serve on his strike force to reopen Texas. That was Mark Watts, president of the Friedkin Group, Nancy Kinder, leader of the Kinder Foundation, and Massey Villarreal from Precision Task Group. I should also point out that Mark Watts, in addition to his role at the state, has been leading the partnerships effort to think about this from a local perspective. And so we've done a number of things to refine our thinking on what reopen means for Houston. And we've established some industry working groups and pulled in more than 70 business leaders from companies large and small, and also conducted a survey that received input from over 850 businesses. We'll talk more about those working groups here in a little bit. But I think all of our members should know that the input that they've provided and the leadership from Mark Watts, we've been able to take partnership member feedback directly to the governor. And so we've been deeply involved, and we're pleased to see the governor's report on Monday. So why don't we shift and talk in more specific detail about that report, Bob? As I said, it was released on Monday, accompanied with 3 executive orders. Can you just give our members a brief overview of what's in that report, what's in the executive order, and some of the nuances in both?
Yeah, sure, Taylor. And Let me start by reminding everyone that you'll recall back in March, the governor issued his executive order that only allowed essential services to remain operational. The governor's order followed on the heels of Judge Hidalgo's order, which had similar language in it. And so the industries that were deemed essential are shown there on the screen. These come out of federal guidelines. You've heard reference to the CISA, Cybersecurity and Infrastructure Security Agency. The CISA 16, as they were called, indicated what would be deemed essential. Now, somewhat interestingly, Governor Abbott didn't like to refer to his original order as a stay-at-home order. And it took a couple of days to clarify across the state and across the nation that he had indeed issued a stay-at-home order. He had just chosen not to describe it as such. So it's important to realize that, because you then to realize that the new order issued this past Monday builds on that previous order. It does expand the list of businesses that are allowed to operate, but it's still essentially a stay-at-home order. And I want to highlight the language here on the screen from the executive order. We're just quoting from that. In accordance with guidelines, every person in Texas shall, except where necessary to provide or obtain essential services or reopen services, minimize social gatherings and minimize in-person contact, with people who are not in the same household. So just to hold that thought for a minute, the order begins with a very clear statement that the governor is requesting and expecting people to minimize social gatherings, minimize in-person contact, but he is, as we'll talk about in a minute, beginning to allow new segments of the economy to open. So let's turn to that aspect of the order. So he very specifically lays out a series of reopened services that would be allowed to resume operations tomorrow, Friday, May 1st. He points out that in a recent order that he had already allowed retail services to begin operating through pickup delivery type services, not in store, but he had already opened the door a little bit for retail services, but only on a pickup delivery basis. But beginning tomorrow morning, 12:01 a.m., he's allowing a whole new set of businesses to reopen. Now, those are in-store retail services, dine-in restaurant services, movie theaters, shopping malls, museums and libraries, services provided by an individual working alone in an office, that's the exact language, and golf course operations. Now, the key about the services, customer-facing services, is they'll only be allowed to operate up to 25% of their total listed capacity. So in any of these customer-facing areas, we're only opening up 25% of their capacity. Now, separately, churches and religious services are also allowed to continue in accordance with the updated guidance from the Attorney General. Many of you in the faith community saw the message from the Attorney General a couple of weeks ago. Schools and higher ed institutions remain closed for the remainder of the academic year. And of note, the governor did not include bars, gyms, certain entertainment venues, barbershops, salons. He did not include those businesses among the businesses allowed to reopen on May 1st. And as he said at the press conference on Monday, advised by his medical staff, he chose what businesses he thought were appropriate and safe to reopen and which businesses should be delayed a little bit longer. Now, he did mention that he would look at these other businesses, the ones that remain closed at this time, and perhaps open them in a phase 2 that could occur as early as mid-May, May 18th. So now he did, and I want to point this out as well, because there's been a lot of discussion of face coverings. He very expressly encouraged individuals to wear appropriate face coverings. And the order did state that no jurisdiction can impose a civil or criminal penalty for failure to wear a face covering. So there's been a lot of discussion now about how the governor's order intersected with the Judge Hidalgo's order. But the clear statement there is that he has removed any penalty associated with such an order, but at the same time, very much encouraging the public to adhere to the essence of that order, which is to wear a face covering anytime you're out in public, certainly anytime you're inside a retail establishment. Now, this new order expires on May 15th, at which point we would anticipate that he'll issue a revised order, and he may or may not allow us to move to phase 2 at that point. He's indicated that in phase 2, we would take the capacity limits from 25% to 50%. So still just a gradual reopening. But he indicated that he would be guided by the data and by his medical advisors as to whether it's appropriate at that time to move to phase 2. He could simply issue an order extending phase 1, or he could issue an order on or about May 15th that moves us on to phase 2, whatever that might be, but presumably opening up to that 50% of capacity. So on balance, we think the governor reached an appropriate balance. We can't trade off safety. We have to be mindful of safety, but we do have to begin reopening our economy. We have met those initial triggers and tests, as I said at the outset. So we believe at the partnership that the governor's order is very appropriate. Now, he did make a point to say more clearly than ever before that his order supersedes local orders. So a local order cannot open businesses that he didn't open, and a local order cannot restrict further businesses that he is allowed to open up to some limit or some restriction. So local leadership is not allowed to materially deviate then from the governor's order. He did indicate that if data were to suggest that a region needed to move backwards in this process or to be delayed further, that would be his decision. He, at the level of the governor, would be making that decision. And as you recall, if you listen to his press conference on Monday, he already made a distinction between those counties that have had 5 or fewer indicated cases and the rest of the state. There's a handful of rural communities that have not seen a substantial uptick in the virus, and he allowed them to effectively progress immediately to phase 2. And I'm sure Taylor will come back to this. Before Monday, but certainly since Monday, we've been focused on how do we help business operate, open up under this new order, but we're excited to be at this point. Taylor?
Yeah, I mean, I think just a couple of comments on the order. One, I found it interesting that the governor, in terms of instances where there may be increases, are where he may need to jump in to the local setting and dictate further restrictions. Those factors that he'll use to make those decisions were not expressly articulated in the order. So provides a lot of flexibility there. But you know, he again made very, very clear that the state order does in fact supersede the local order. If I recall, there were at least 3 references in his press conference to that point specifically, which in some respects, you know, provides certainty and the degree of clarity that we need to move forward. Shifting gears a little bit, inside of the governor's report, very different from the executive order, but inside of the report, he covered quite extensively was the issues of testing and tracing. And throughout this crisis, there's been a focus of the media and political and healthcare leaders on the importance of testing. And as a testament to that, as I look here on the live questions, all of the questions we've received thus far have been related to testing. So it's a really, really hot topic. And so for the benefit of our members, Bob, can you talk in a little more detail about those 2 subjects, and then specifically how are they addressed inside of the governor's Open Texas plan?
Well, first, we're very pleased that he took as much time in the plan and in the press conference to talk about this issue of testing and tracing. As we all know, testing has been an issue nationally and locally throughout this entire period. The country was clearly caught flat-footed when it comes to testing capacity. But he has spoken to that. He's laid out a plan, and we feel good that he's put forward a plan that appears to be adequate and perhaps even aggressive. On the issue of testing specifically, the state is now able to conduct somewhere between 15 and 20,000 tests per day. We're averaging 14 to 15,000 tests. He indicated plans to ramp that up to a capacity of 30,000 tests per day. So a substantial increase. and we're starting to see indications now in Houston. We've added capacity in Houston, and we have certainly have days now where the public capacity, that capacity that the public can access for free, is not being fully utilized on many days. That's a good thing. That means we're getting a system out available to the public beyond their requirements. And of course, private testing is absolutely available today in Houston and to an adequate degree. I'll stop here for a minute. What creates some of the confusion around testing is what are we doing testing for? If we're testing symptomatic individuals and individuals who've had contact with symptomatic individuals, we clearly have enough capacity today to do that. There's no issue now in Houston and in Texas. We have enough capacity to test anyone who's symptomatic and anyone who has contact with symptomatic individuals and therefore wants to test. But some people want to use testing for screening populations, and in some cases we need to do screening. If you're in a job where you're exposed to a vulnerable population, you're working at a nursing home, you're working at a hospital, we won't be testing you simply necessarily when you're showing symptoms. We'll be testing you regularly just to make sure that the disease is not getting into the nursing home or the hospital. So that's a matter of how much of that kind of screening we're doing. But for the screening we're doing today in the medical community, in the nursing home community, we have enough capacity for that as well. Now, some people say also there's testing for surveillance purposes, where you now do it. It's kind of like an academic issue. How much of the population or how much of a given population might have the disease? Now, we do not have, and we have not implemented a surveillance testing program in Texas. I'm not sure we have anywhere in the country except in very isolated instances. So there's always confusion when people say, do we have enough testing or do we not? It's really, well, to what use are they talking about? The primary use of testing in our plan here in Texas is to test individuals who are symptomatic and to test anyone who's had contact with that person. So that, and of course, that number is would be quite a bit larger than just a simple number that are symptomatic. So we're now reaching a level of that. Another indication that we've reached an adequate level of testing is the percent of people tested who test positive. If the percentage of people who test positive is very high, that means you're probably not testing enough people. We're now down in the 5 to 10% range, which from the very beginning has been indicated an adequate testing program should be generating results. 5 to 10% of those tested would be positive. Now, there has been some confusion with the business community, again, about what their role might be in testing. And I think the key is to go back to that notion that we're not asking businesses to begin testing their employees. Yes, we will quickly run out of testing capacity. The reagents, the other key elements of testing will run out if businesses now decide that they want to test their employees before they let them go back to work. That's not what's being suggested by anyone at this point. What business should do is if someone is symptomatic, if someone indicates either from calling in from home or during the day at the workplace that they're experiencing even mild symptoms, we want that employer to send that employee to be tested. So that's the role of the employer on the testing side. And we'll come back to another role of the employer when we talk about tracing. Now, the other thing to remember about a test, it's a snapshot in time. So someone who tests negative, which is to say does not indicate the virus, all that has shown is that on that day when they were tested, they did not have the virus. It does not say 3 days later, 5 days later, 2 weeks later. So again, keep in mind the limits of what testing can really accomplish in our community. Our concern at the partnership has been less about testing than it has been about contact tracing. So that's the other term you hear, testing and tracing, or testing and contact tracing. And there, again, the governor was quite explicit. It indicated that the state had reached a level of contact tracers statewide of just over 1,100 at the time he gave his presentation. He said he would have another 1,000 tracers by May 11th. And by the end of the month, we would have 4,000 contact tracers operating statewide and using an integrated process to gather that data, which is equally important. We have to be able to use this data in an effective manner. Now, Harvard has published a study that's often referenced that talked about a need for contact tracing, that if you boil it down to Houston with the appropriate ratios, it would suggest that we need something like 1,000 to 1,500 contact tracers in the greater Houston area. So if the governor at the state level hits 4,000, we get our typical and an appropriate share of that, then we'll reach that level of 1,000 to 1,500 contact tracers in the Houston region. So why is that critical? Well, if we get a test and we're trying to control the propagation of this disease, we need to identify who that person has had contact with, and that's the function of the tracers. Hopefully that explanation helps, Taylor.
No, I think that's really helpful. Where some of the confusion probably stems from is that this notion of testing and tracing get conflated, and so then which ones are you talking about at any given time? And we know that the county through its health department is moving aggressively to hire contact tracers. So on the testing side, it's almost more of a supply chain, which appears to be adequate at this point. But then on the tracing side, it's a real human capital issue. How do you find the people that can go and do this contact and really ensure that we have a sense of who symptomatic individuals have interacted with. And again, I mentioned the medical center at the top. And big part of the med center is the UT School of Public Health, right? And so if in conversations with them, we've been working closely with them throughout this entire process, and Dr. Boerwinkle over there will talk about the workflow of testing to tracing to then what do you do when you reach the point where someone is symptomatic. And so that guidance is sort of baked into everything in terms of the way in which the partnership's formulating its thinking. So I think those are all important points.
Since I touched on the role of business when it comes to testing, let me come back to that issue of the role of business when it comes to contact tracing.
Mm-hmm.
I said before that on testing, we're not asking companies to test. We're only asking them to send symptomatic individuals to be tested, or people that you know that they've had contact with to be tested. Now, with respect to tracing, I think there's a more explicit role for business in tracing, because you should be asking your employees to at least consider keeping some kind of log of who they're having contact with day to day, such that if they were to be found to be symptomatic, they would be able to tell someone at the workplace, I have spent significant time with this person, this person, this person, and this person. Most companies are going to want to be able to do some degree of tracing, contact tracing, within their own work environment anytime they have someone who indicates symptoms. So in that respect, companies should be thinking about how they're going to do that, who's going to be given that task, what are the protocols of doing that, what they're going to do with that data. But I wouldn't be relying just on the public health authorities for tracing. That figure of 4,000 that I mentioned statewide, or 1,000 to 1,500, that would be the public health authority tracing capacity, which is really trying to trace the disease out into the community. I would be setting up a system to do contact tracing within my own office. How is that going to happen? And I know some of you that are essential industries have been operating in this mode and have already had to do this, and you've established those kind of procedures for contact tracing. But there is a role for business directly in contact tracing.
No, it's a great point. Why don't we shift gears a little bit to specifically talking about we were just then talking about the role of business in contact tracing. Why don't we talk a little bit about how business is approaching reopening in general? And so let me talk, just again, set the stage a little bit for what the partnership's been doing in this space and our work to provide advice and guidance to employers that are moving toward reopening. So let me talk a little bit about the working groups that I made reference to earlier. Last Thursday, the partnership began convening. We had 8 working groups, and comprised of 70, 80 business leaders, community leaders from around the region. And we facilitated 2 meetings over beginning last Thursday, and then another one just on Tuesday. And the first one was to gather input from these groups about the challenges that they're facing in their respective industries. And then intentionally, we scheduled a meeting on Tuesday to gather feedback from these groups, specifically related to the governor's order. And the goal of this was just to help us as a region and as a business community better define how Houston can reopen safely, sustainably, and successfully. We split the groups out more or less by their operational risk profiles. So that meant that we were we batched up all of the what we called industrial, the more or less the essential services that had been operating throughout this time. And then we had an office workers group. We had a high touch consumer facing group. We had a small business group, social services, education, et cetera. And across all of these groups, let me just outline the 4 key themes that we pulled out of those working group sessions. One is that they all agreed that reopen protocols should be industry led and not overly prescriptive. The second one, second key theme was reopening should be gradual and deliberate. And then the third one was future business interruptions should just absolutely be avoided at all costs. The shock to the system that closing has would, if having to be absorbed a second time, would have real severe impacts for those businesses. And finally, the last key theme was that, and this one's less tactical in nature, but while the protocols and practices are important, public confidence is really critical to restoring demand and everybody getting back to work. And so we felt that those 4 themes were very, very important. And as we move forward, the partnership is taking on a number of initiatives and that have been obviously informed by these working groups, and these valuable insights are really driving a lot of our efforts. Bob, we have a number of efforts that are underway, Work Safe and others. Can you talk about those programs that we're specifically undertaking, and then how our members can plug into those resources?
Sure, Taylor, and thanks for that summary. As you indicated, we've been working on Reopen Houston Safely, which is the term we gave to it right from the beginning. We've been working on that now for several weeks, as you indicated, and we've had very broad participation. We have 70 leaders, as you indicated, working in the working groups. We have other forums for input from our members and our board. So we've had a lot of input. And we also have had a survey. We did a survey. We've had several surveys in recent weeks, but we did a specific survey to try to get at the issues associated with reopening. And thank you for all of you who participated in that survey. One of the overall conclusions of that input was that we shouldn't try to reinvent the wheel at the partnership. We shouldn't kind of from scratch try to define the principles of a safe reopening, that we ought to use the guidance that's out there. And that's what we've done. We've reached out to trade groups. We've reached out and reviewed material that's coming out of various levels of government. And then we brought that to the working groups and got their feedback. I do want to indicate is on this slide, houston.org/worksafe, to go directly to the material that we've developed that has to do with working safely. Go to this site, houston.org/worksafe. Now, when you go there, you'll see a number of things, but primarily you'll see our list of 15 WorkSafe principles. We had initially, after the judge's order back in late March, issued a list of 10 principles, WorkSafe principles, and over 150 companies had pledged to adhere to those principles, and we were very pleased with that response, and people found them useful. But in light of the continuing advances in this discussion locally and nationally, we did update those principles. We now have 15 principles, as you see here on the screen. And so it's just an evolution. We wanted to be sure we reflect the best federal and state guidance. And frankly, industry trade associations have been very productive during this period. And so we just mined all of that. And what we would describe, these 15 principles are meant to meet, exceed, or expand on the guidance that the federal and state authorities are giving. not to take the place of it, and there's a lot out there for you to consider. Now, the backdrop for this is a belief that business has a vested interest in getting this right. We care about our employees, we care about our customers, we care about the general public. We care that this reopening process goes well and can continue forward until we're fully reopened. So I do believe that business is and will take this very seriously. There's been such a strong response to our providing these resources, these principles, and other guidance. They're very much looking for such. I encourage you to consider these principles as you think about reopening. And for those of you who've remained open by virtue of being essential, I would look again at this list to see what you might be missing. Now, we've gotten a lot of questions about office workers. And Taylor, maybe I may just jump to that.
Yeah.
If you read the governor's plan and you read his executive order, there's no explicit reference to office workers. Office workers are not an industry. They're not a sector of business. They exist in most business sectors. So he didn't speak to that. But there is a clear implication that those that are able to telework, those who are able to do their job without going into the office should continue to do so. Based on this order, which opened a relatively small list of businesses, think about it, you know, retail, malls, a handful of things, theaters, we shouldn't see a wholesale movement back into the office environment. There's a lot of discussion about how that will happen, and I think we need to be planning for that. But this plan did not call for that to happen. Our view is that office workers should continue to telework if at all possible for quite some time into this process. For the partnership, you know, we're thinking kind of a month at a time, and we've made it clear to our staff that we will continue teleworking throughout the month of May. So we're well beyond kind of the governor's current planning, but we'll see how that develops over time. Some of the discussions nationally about a 3-phase recovery would indicate that office workers should not return until that last phase. Now, there's another issue, which is, and this question has been covered heavily in the media in the last day or two, are the customers ready to come back? You know, we can open business and accomplish nothing if the customer doesn't reappear. One of the issues then that business faces is how do they project to their customers that they're taking the needed steps? And so the things we do in business, to separate tables in a restaurant, to have our staff wearing masks and gloves, to insist that customers, patrons, not bunch up in a queue, that we maintain the social distancing. In addition to keeping them safe, it communicates to them that we're attempting to maintain a safe working setting. And I think that's what's going to build consumer confidence over time. It should be clear that you are adhering to the guidelines for your industry when you reopen the business. That should be clearly evident to customers. Now, there's a set of customers who are dying to get back into a restaurant. There are customers who are dying to get back into a retail environment. I think there are others who are going to hang back for a while and see what happens, see what others do. Their first experience going out to dine in a restaurant is going to tell them whether we're really ready or not. They're going to judge that experience and decide, did that feel safe? Were the steps taken in this restaurant that were described to me and that I heard about? Hopefully everyone will be mindful of that. We don't get multiple chances to get this right. I won't say the restaurant chain that I'm thinking of, but one of the major restaurant chains this week is operating one of their restaurants using staff only, just to model all of these issues, all of these conditions, to get their procedures right, so that first impression on Friday from a customer walking into their restaurant chain will be the desired experience, the desired perception. That's the kind of thinking we need. Take Friday seriously. Take tomorrow seriously. You know, you only get one chance to make a first impression, as they say. In many respects, tomorrow's a first impression. Taylor?
Yeah, I think those are all great points. Especially the customer readiness, the consumer confidence that has to be in place for all of us to get fully back up and running. In fact, Bob, in some of our looks like we've gotten a number of live questions specifically related to businesses gaining access to PPE and sanitation supplies, and so it looks like there's some real concern related to supply chain in that regard, and that clearly factors into this confidence piece. and supply chain's been sort of sprinkled into various conversations that we've been having over the last few weeks. Do you have anything to add on that point?
No, I mean, as we've dug into PPE, we've typically found that it takes some work and some research to find the sources, but they're out there today. And the big PPE question that we had 2 or 3 or 4 weeks ago is gone, and people are able to secure PPE. What we may need to do in the coming days, Taylor, is actually to think about how to be more helpful and point people to PPE supply. That's probably not something people gave a lot of thought to before. Sure, the medical system, had an existing supply chain for this, and some of you in your businesses had a supply chain for this, but others didn't. So let us think about how to just simply guide people to the right sources of that. But beyond that, I would suggest every indication I've gotten from people that have delved into this is the PPE is there in adequate number, but it's just a matter of some of us learning how to navigate that supply chain.
Yeah, I suppose when some small businesses, their supplier is Amazon, that could present problems. So I think that we're the business communities, we're going to have to collectively get creative in how we deal with this, and the partnership can absolutely play a role in that. Bob, I didn't realize that we've already blown through our time. But let me maybe we'll just end with a bit of a general question. One, how can members plug into the work that we're doing? But then I think our members may appreciate how it is we're thinking about reopening our own operations. So can we end on that note?
Yeah, I'll speak to that briefly. As I said earlier, we're going to continue teleworking certainly through the month of May. And when we stop teleworking, it won't be black and white. We'll start bringing some people back to the office for a variety of reasons. We're going to do that in a measured way. Make sure all of our procedures are in place. Make sure we can maintain social distancing in the office. All of that will be in place before we begin that. I think from the standpoint of our members thinking about interacting with the partnership, we have relaunched most of our programming activity, events and programming of all types. You're all familiar with all the various committee meetings, programs, and this and that. We've relaunched almost all of that at this point, but it's all being done virtually. We're finding the virtual method is more effective than we would have ever thought. We're getting lots of participation, in many cases more participation than we were getting for in-person meetings. So we'll continue that. We do hope over the summer to begin to offer some of the more traditional on-site programming, and we'll ease into that, but we don't know when this summer that will be feasible. On the one hand, we're not trying to move faster than is appropriate. On the other hand, the partnership is seen as a bit of a leader and a barometer, so we want to be cognizant of what we're doing and not doing and what signal that's sending. So I can see us having some hybrid events that are both online and in person, but keeping the number of people on site to some relatively modest number. What I can't say today is when we'll have our large scale physical events again. When will, a state of this and a state of that. That's easily months away. But as all the discussion out in the public would indicate, we still don't know how this disease is going to progress and how comfortable we'll be. If we don't have a treatment for the virus, and if we don't have a vaccine for the virus, then we know for a long time we're going to be operating in this mode of still trying to limit the rate of transmission. And that would discourage us from having very large scale events, even months down the road. But from the standpoint of membership, there's a lot with which we can engage today. And it's just a matter of all of us getting comfortable with this new form of interaction by video.
Yeah, well, I would encourage everybody that joined us today to please go to houston.org/worksafe. That's going to be an evolving product that we're going to continue to iterate on, and our goal is to make that a very useful resource to all of our members, large and small. And if there's anything that we at the partnership can do, please don't hesitate to reach out to anybody on staff, and we'll be sure that those inquiries get put sent to the proper person. And we appreciate everything that our members are doing for us to be able to reopen our economy, and certainly appreciate the leadership from our elected officials, state and local, as we move through all of these uncertain times. So with that, Bob, I think I'll turn it back over to Carrie, and hope everybody has a great day.
Great. Thanks, Bob, Taylor. Appreciate it. I'm leaving this slide up on the principles for a couple of seconds for folks to be able to take a screenshot. Again, the entire deck is going to be available in a recorded fashion, but appreciate Bob and Taylor's time and look to see Bob here in the near future as we continue our member addresses as needed, clearly. Also, just some of the questions we got that we weren't able to get to, but we will stay on for a few minutes to answer those in the Q&A section by text. I will mention that the Greater Houston Partnership's LinkedIn page, open and available for members, does have announcements of companies that are producing hand sanitizer, distributing hand sanitizer, as well as PPE. So that information is available if you are seeking that, but we will come up with a process and a communication plan to let you know about what is available. Next, just very quickly want to share a couple of upcoming events for the rest of this week. Every week, of course, we have plenty to offer, but this afternoon we actually have an Upskill Works forum on our current and future workplace considerations, and that's through our Upskill initiative. And on Friday, tomorrow, we will be hosting a Women's Business Alliance coffee talk on work-life balance, and that is from 10 a.m. to 9 a.m. to 10 a.m. tomorrow morning. We will be putting out a weekly list of events and activities every Friday, so be on the lookout for that, and we'll continue to communicate that through our Houston.org events page. We very much look forward to seeing you in the virtual world again. I will leave you with our COVID-19 resource information for you to jot down, and have a wonderful Thursday, and we'll see you back here again. Thanks, Bob. Thanks, Taylor.
Thanks, Carrie.